Yeah, thank you, Greg. I'm honored to share my story this evening. So, as you mentioned, I'm an oncologist. I practiced breast cancer for about 30 years, and I loved every minute of it. I would do it again in a heartbeat. In fact, my oldest son is a surgeon. He just started his own practice in August of this year. And so I loved every minute of it. But as time went on, I started to see younger and younger women with breast cancer. And I thought, what is going on? It's kind of like that pediatrician that sees those 8 and 10-year-old children with type 2 diabetes. Um, and so I came to the realization a lot of these women were overweight or obese. And there is a huge connection between our body weight and our risk of breast cancer. So, women who struggle with weight have higher circulating estrogen levels, and that's the precursor for breast cancer. So, I became emotionally, consumed with helping women not only curing their breast cancer through the conventional treatment, but also helping them with their diet and their lifestyle, because I knew that it was much more than surgery, chemotherapy, and radiation if those women were going to reduce their risk of developing a recurrence or a second cancer. And many of these young women, of course, had children themselves, babies, toddlers, young children. And as a mom myself, I wanted these women to maximize their health and well-being so that they could raise their own children. That was just so important. And so I started to use this lifestyle program within my practice, and I had really, really good results, not only with the patients, but with their family members, their coworkers, people outside of my medical practice. So fast forward 5 years, 5 years after I started to incorporate lifestyle medicine into my practice, one of the major hospital systems came knocking on our door. I was a founding partner or a founding physician of the Holistic Breast Cancer Center with 4 other women physicians. We had grown to 10 doctors. And because we were so successful, people wanted to buy our practice. I voted against the sale. 8 of my 10 physician partners voted to sell. And so overnight, it became a corporate entity. And it became so difficult for me to go into work every day. I stayed 2 years, but then I decided to jump off the cliff because my nurse of more than 15 years had been let go. My physicist, because she was at the high end of the pay scale, my physicist of more than 10 years was let go because he was at the high end of the pay scale. So we went from our holistic practice, where the emphasis was on our patients and their families, to the corporate model, where the emphasis was on revenue. And so I jumped off the cliff. I was only in my mid-50s. I was a single parent. I had a child, I had a son in college, 2 children in high school and private schools. So I needed to make it work. And I did make it work. I started to share it with more patients and people in the community. I brought some health professionals into my organization and helped them. And now I have such a balanced life. I didn't realize how dysfunctional my life was until I left mainstream medicine. I have time to spend with family. I work from home, but I can work from anywhere in the world with my cell phone, internet access, and a laptop. I didn't have friends before. I have so many friends. And this medley of pictures shows some of the things that are most important in my life: my children, My mom died a few years ago, and she was able to spend months and months at my home because I had time to care for her as she was in the final years of her life. She went from my house to my sister's house. So anyway, I love my life. I have joy, I have balance, and I want to help other physicians be able to create what I've been able to create. So thank you so much, Greg, for asking me to share.